Oxfam South Africa has launched a healthy inequality report. The report shows that poor working conditions for healthcare workers lead to poor healthcare for all. We're joined via Skype by one of the partners of Oxfam. He is the legal advisor at the International Commission of Justice, Tim Hodgson. Tim, a very good afternoon here in South Africa. Thank you so much for making the time. What is your involvement with this project and what is it all about?
So Oxfam and Unequal, which is the Young Nurses Association, have spearheaded this research, and there's a bunch of other organizations, including the International Commission of Jurists, that have participated in the research and will be supporting the campaign to improve conditions faced by health workers, especially nurses and community health workers in South Africa, because we believe that the current situation is a violation of their rights to work and their rights to health, but also presents a very serious threat to all people's health in the country.
The rights of healthcare workers during this pandemic have been a constant topic. Are the right people listening?
I think that speaking from an international perspective for a minute, I think that overall in the world, we're seeing that healthcare workers have a higher infection rate of COVID-19. As COVID pandemics increase all around the world, there's been evidence of stigma, discrimination, sometimes even violence against health workers. And unfortunately, globally, governments have been quite slow to act. Sometimes have cracked down on health workers when they try and speak out about the conditions they face, whether it's a lack of protective equipment or just seriously understaffed conditions that they're facing. In South Africa, it's been clearly in the news that we've used our community health care workers to get the penetration of testing that we've got, and we've done a lot of tests. But community healthcare workers are increasingly reporting that they are facing stigma, they are facing discrimination, and they are facing conditions which don't allow for them to do their work.
Let's talk about the report. What were the focal points?
The focal points, the report is quite extensive, and I can just emphasize some of the things. There are policy gaps which the report points out. The first thing is that there is an exclusion in the regulation of working hours for many healthcare workers, including nurses and community healthcare workers, which means that sometimes you end up with health workers working for extremely long periods of time, up to 24 hours, and this is not good for anyone's health. And this is a usual thing. It's not only COVID-19. Secondly, many nurses and community healthcare workers face insecure working conditions, including low pay, low social protection, and also an ability to be dismissed or not used. So this increases their vulnerability and requires them to sometimes take jobs moonlighting, which is taking on extra work, which then also increases their workload, and I'm sure reduces their ability to produce the types of healthcare services that we want. Then there's other problems that are quite gendered, because we must also remember that community healthcare workers and nurses around the world are predominantly women. And so there are problems faced when traveling to and from work, especially at night. There are threats and risks of gender-based violence, even when community healthcare workers are just doing their jobs in communities. And really, finally, and something which I think the report really emphasizes, is that we have a very unequal healthcare system in South Africa, where roughly 20% of people access healthcare through the private sector, although most of the resources that go into healthcare go in that sector. And most of the healthcare workers working on healthcare in South Africa are working in the private sector. And so the report calls for a democratization of that system and implementation of something that the African National Congress has been promising since the first campaign for Jacob Zuma's presidency at least, which is universal healthcare, national health insurance. And it calls for this to decrease inequality in the system and improve the conditions of healthcare workers and also the output for the public.
It's interesting that you're talking about the universal healthcare, and I want us to come back to that when we talk about conversations that need to be included now, because the only conversation seems to be the coronavirus conversation at the moment. But I want to ask you, which countries did you sample in your investigation? And I'm putting this against the backdrop of a story we're running this morning about nurses in Zimbabwe downing tools because they're not happy that they're being paid in the local currency, which is not sufficient to help them with their life costs.
So in this report, the focus is exclusively on South Africa, although some comparisons are drawn to other countries. And this was just Oxfam and Unequal's focus. and the campaign's focus. But we know that this problem is happening all over the continent and in the region and also elsewhere. So you've seen healthcare workers in Nigeria protesting. You've seen health workers in Thailand having to make makeshift masks and protective equipment. And it all is the same that happens here in South Africa. And partially, although we do focus on the spikes in the epidemic in Cape Town and Joburg and places like this, it's even more of a concern in rural areas where we know that the healthcare system is severely stressed even at the best of times. And so healthcare workers are really facing these conditions all over Southern Africa, all over Africa, and all over the world.
So how were you able to measure the outcomes?
So the outcomes of the system or the outcomes of this report? I mean, I think that I can just say that generally the evaluation of the healthcare system is not very controversial. The Department of Health itself accepts that the healthcare system at the best of times is stretched. And really what this report does is it takes the voices of healthcare workers themselves, which I think is the right place to start, puts them in the front and center and says these people are struggling, and they're struggling because of the fact that we don't appreciate them enough. Even though some places here in South Africa we are still clapping and celebrating and cheering like the rest of the world at 7 p.m. for healthcare workers, we're not taking the healthcare workers at the bottom of the rung doing most of the coalface service delivery seriously enough. And I think that the evidence comes pretty clearly out of that report. And there is other evidence in other countries in the world, and organizations like the International Association of Nurses have also pointed out that this problem is global.
Tim, on a different day, would have loved to have a longer conversation with you about this, but that's where we have to end it. Thank you so much for talking to us.
Thank you very much.
Tim Hodgson is the legal advisor at the International Commission of Justice, talking to us about a report that they've put out with Oxfam.